Are migraines and headaches ruining your life? Do you find that your friends and family members just don't understand how bad your pain really is and what it's doing to you? Do you feel like you're losing energy and interest in terms of interacting with these people that you love? Do you find yourself losing patience with your family because your head hurts so bad and you just can't handle it? Do you find yourself struggling to get through the workday or trying to get yourself ready for when the kids come home from school because your head hurts so darn much? Are you frustrated and depressed because you've seen multiple doctors and multiple specialists and they don't have any idea what to do with respect to your headaches? Have you had multiple MRIs and CT scans and x-rays and they're all relatively normal and there is no explanation for your pain? Do you feel like you've seen multiple physical therapists or chiropractors or massage therapists and they've done everything they know and you still have the headaches? Well, if this is you, I'd like to tell you a story about me. My name is Tim Bonack, and I'm a physical therapist and a Canadian trained osteopath, and I own Manual Edge Physiotherapy. And 20 years ago, I had a problem with significant headaches. I was a student at that time, and stress was increasing quite a lot, and I was getting a lot of headaches, and they were basically on a daily basis. They would start back here in the upper neck, they would radiate over the top of my head, behind my right eye, and then it would feel like there was an ice pick stuck in the right side of my temple. It was the worst pain I've ever had in my life, and it just wouldn't go away. I would find myself secluding myself in the bedroom where it's nice and quiet and dark, and I just couldn't take it anymore. Sometimes I'd get so painful I'd actually get nauseous. I've never thrown up because of my headaches, but I know a lot of you have. But I was very fortunate because at that time I learned about the cranial system. You see, when I was a kid, like most kids, I had multiple blows to my head. Some of them were pretty significant, actually. But again, back in the day, nobody really cared about that. Basically, if you could walk and talk, you were okay. But what I didn't realize was that those blows to the head can actually influence how this whole system works. I was again very fortunate because my instructor during one of these classes actually treated me, and she spent about 25 minutes or 30 minutes on my head and specifically on some of these facial bones and facial structures that I'd had blows to, and she normalized the mobility of those structures, and much to my delight and surprise, it changed the mobility of my upper neck like it had never ever been changed before. Not by previous physical therapy, not by chiropractic, not by massage. And since she did that again 20 years ago, I've not had any difficulty with headaches, and my upper neck has moved continually as well as it ever has and probably ever could. So what we have here again is the cranial system, or it's another word for the head system. And it refers to the different bones that basically comprise the skull. It's composed of many, many different bones, and they're all in different colors. In between the bones, we have what are called sutures. And that's essentially just where one bone overlaps another. So there are many different sutures in the head, and they're very important because movement takes place there. Now, I'm not talking about movement like I move my elbow. We're talking about little bits of movement, but still very important nonetheless, because in these sutures you have nerves, arteries, and veins that go to different parts of the body. And like on the bottom of the skull here, you can see lots of different holes through which some of these structures run. And when you have a blow to the head, what can happen is you get jamming of some of these different sutures. And when that happens, you're either going to have tension upon some of these structures or compression on some of these structures in terms of, again, the nerve, artery, and vein, which causes pain. Unfortunately, there is no test to determine if you have a cranial problem. Okay, so like if you had back pain, we could have you stand up and bend forward, try and touch your toes. We could say, yeah, you're tight there. You know, you probably have a restriction of motion, and we could probably help you. Or if you had shoulder pain, we could ask you to move your arm up over your head. We could say, yes, this isn't moving right. We can probably help you. Well, with the head, it's a bit different. Okay, we can just move the head upon our neck. We can move our jaw, right? But we really can't move all of these different structures. So the best way for you to think about whether or not you have a cranial or a head problem with how these bones move is to really think about your history. Meaning, have you had blows to your head? The blows can be big, the blows can be small. Believe you me, I've seen many different scenarios over the years. What's consistent with these scenarios is there's always something. So you really have to think back. And for many of us, that's thinking back decades in terms of have we had any blows to the head. Sometimes we don't have blows to the head, but we have other physical insults in terms of the cranial system. One of those is orthodontia. Okay, so we have all of these nice braces that are put on our teeth. We wind up with some really nice teeth, right? Which is great. Unfortunately, during that process, when you're putting tension upon these structures, all of these things have to slide around as well. So that can be another source of a cranial problem. Same thing with respect to, let's call it overzealous dental procedures in terms of some of the physical forces that they use to accomplish what they want with the teeth. Sometimes, as a result, they do jam some of these structures too. I've seen that many, many times. So the best way to determine if you have a cranial problem is to think back in your history about some of these situations in terms of blows to the head or orthodontia or TMJ issues or what have you. And then if you do have headaches, you would benefit from a thorough evaluation of this cranial system. The evaluation consists of you coming in and us feeling how all of these different bones work. So we would use light pressures on your body, and we can actually motion test how all the bones work and move to decide if they're moving normally or if you have a cranial problem. And we're not just looking at the outside of the skull, but we're looking at some of the bones and structures on the inside of the skull too. Now, we can't touch the inside of the skull. What we do is we use pressures on the outside of the skull to get to the inside of the skull. I know that sounds kind of strange, but that's really how it works. But if you do the evaluation, we can then determine what we need to do in terms of effective treatment to release, which means soften these structures and restore normal motion to these structures to create a pain-free situation. Treatment is basically gentle pressures upon the skull in terms of different areas to get that release. It's actually very pain-free and can be very, very effective in terms of improving or eliminating the migraines and the headaches. In addition to the cranial system, of course, we look at the neck, okay, because the skull sits on the neck, and we're looking for how the vertebrae move in terms of the normal mobility of the vertebra, and we're looking also at how the soft tissues and the muscles feel and move with respect to tension or spasm. So if this sounds like this might be you and you're interested in having an evaluation to determine if you do have a cranial issue, give us a call at Manual Edge Physiotherapy, 719-694-8342. And if you do that, you can ask to speak to a physical therapist to determine if we might be of some sort of help for you in the future in terms of evaluating and releasing these cranial issues to get you to a pain-free head status. And believe you me, it's a great place to be. Thanks.